Do you ever have those moments where you feel like your leg is just numb, just tingling, or you suddenly have pain and you feel like, oh my God, I can't move it? Then my friends, you may be experiencing what's called
Sciatica.
What he said, sciatica. So let's first talk about what sciatic is. Let's go. Sciatica is generally a compression of the nerve root, which is essentially comprised of the L4 to the S3 nerve that essentially comes from your back all the way down to your legs. So now that you know what sciatica is, let's kind of talk about the risk factors. Who are those people at risk of developing sciatica? Now, if you're the type of person who does this, or this, oh come on, that's just so stupid. Why would you even do that? Check this out, this is actually pretty funny. All right, so have you figured it out yet as far as what are some of the causes for why people experience sciatica? It's generally because of prolonged sitting. So what ends up happening is when we end up sitting on our tush, right, on our nice little tush, we end up compressing our sciatic nerve. And that generally runs along basically the meaty part of our butt. And as that gets compressed, the amount of nutrients, if you want to call it the nutrients, the signals that get sent down to our legs gets diminished. And as a result, we experience those things like that pain, that numbness, that tingling, and especially weakness, particularly for those of us who are older and this has been kind of a chronic thing for such a long time. So now let's talk about some of the things that we can do to treat our sciatica. And before I begin, obviously I'm just talking about the simple aspects of sciatica, meaning you don't have any cancer risk, you don't have any specific things like a herniated disc, lumbar stenosis, things like that. All right, now that you've gotten consent from your doctor and you promise not to sue me, let's kind of just talk about the conservative management of treating sciatica. So the first thing we're gonna wanna go over first is how to properly stretch your lower extremity, right? So we'll go over things like the figure 4 stretch in different variations, hamstring stretch. And the next thing we're gonna wanna focus on is strengthening the muscles that are surrounding our hip. So things like our hip abductors, our hip extensors, as well as the muscles of our core, right? You've heard that before, the core muscles. Things like primarily your transverse abdominis. And the last thing we're gonna cover in this video is essentially just how to use a foam roller properly in order to basically just do like a deep tissue massage to your glutes, or in this case, your butt. And if you don't have a foam roller, a baseball actually works pretty well, a tennis ball works pretty well. So anything that's just small, like it kind of just fit on your butt and just kind of do your rolling and yeah. All right, let's start off with our stretches. There's a couple of techniques you can use to kind of stretch out that lateral hip or that piriformis, that glute med area. So I'm gonna show you the first one, okay? This one's pretty easy, it doesn't require too much flexibility. So let's get started. So obviously what you're gonna wanna do is lay down on your back, basically get both knees bent, and whichever side you're having the pain. So in this case, I'm gonna showcase my right side because I've been having some right-sided sciatica symptoms. So you're just gonna wanna do the Ric Flair figure 4, remember the figure 4? And just basically try and bring this foot towards your chest. So not like this, your knee should not be, you're not crossing your legs. You should be literally at a perpendicular, like literally figure 4. You can draw a 4 on your legs, okay? And just bring this up. If you want to accentuate the stretch, you push down on your knee, okay? It's kind of like that. Yeah. And generally, you want to try and hold it for at least anywhere from 15 to 30 seconds, ideally. But if you can't do that, just do what you can. Either way, it feels good. So that's one variation. That is our Ric Flair figure 4 stretch, copyrighted. Just kidding. All right, the next one you can do, this one's a little less stressful to your legs and to your back, body, is you're gonna wanna basically cross your leg on the other side, and you're gonna go ahead and just try and bring this knee to your left side, okay? And you're just gonna literally turn while trying to keep your shoulders down just completely flat. And just, you're gonna feel that stretch along the lateral sides of your hip, like, All right, again, every stretch is about 15 to 30 second hold, give or take. All right, let's show one other situation where you can stretch out that leg. This one's gonna be a little bit more aggressive, but obviously just try the best you can. So you're gonna get into that figure 4 position again, but this time you're gonna be doing it on your, I guess what you call it, the hands and your feet, okay? So you're gonna wanna basically get your leg here, all right? You can see that figure 4, you wanna try and get your leg perpendicular. And you're just gonna try and get even and just try and bring your chest down towards it. Like, Again, this is a very, very aggressive stretch. So if you can do it, great. If not, try and, don't worry about it. And just kind of come down like, again, 15 to 30 second holds. All right, next thing we're gonna do is learn how to stretch out our hamstrings the proper way. All right, the next thing you're gonna wanna probably do is stretch out the hamstrings. So again, since my right side is the affected side, we're gonna be stretching our right side. Now, we all know how to do a proper hamstring stretch, or at least many of us assume we do. And here, let me show you what not to do, okay? This is how not to stretch out your hamstring. So this is what most of us kind of do. We're straight and we kind of bend from our back. Like don't bend from the back, okay? That's gonna, it pulls on your back and it's not a proper way to get your hamstring. I mean, it does stretch it, but it's not the proper way to do it. So this is how you properly stretch out your hamstring, okay? So same position, but instead of bending from the back, you're gonna bend from the hips, okay? So you're coming forward. I see how my back is pretty much straight. So I'm not arching, but my back is straight. And you're just gonna kind of, right there. That's it, I'm right there, that's all I need, okay? Again, 15 to 30 second holds. If you wanna get the upper hamstring, like kind of towards like where your butt is, you kind of have to kind of bend your knee a little bit, okay? Right there, like that just targets it even more. So that's it for the hamstring stretch. Actually, let me show you one more method to really, really get a good hamstring stretch, all right? Let's go. The other way that I personally like to use a wall to stretch my hamstring. And what do I mean by this? I'll show you. Is just put your leg up. Okay, you're gonna get that nice perpendicular stretch. And if you feel like this is not stressful enough, not stretching enough, you're gonna want to come towards the wall, okay? So you're just gonna hop and get that good angle right there and just And it's gonna force your leg to just stay up, like and just work on that breathing. I mean, as far as stretching out my hamstring, this is actually my preferred method, is just finding a wall, just vertical wall, and just exactly how you see it. And if I want to accentuate and stress, get more of a stretch, I bring my legs down towards, closer, right? Like, there's my dog, by the way. And again, you might feel a little bit of your calf stretching. And honestly, that's just the nerves. The nerves are just really tensing and they're just stretching out. So now that we've learned how to really stretch out that leg for sciatica symptoms, let's focus on the exercise aspect of it, okay? Because stretching alone is not enough. We gotta work on strengthening the muscles that are generally tight and essentially weak. Let's get to it. All right, now let's focus on the strengthening aspect of strengthening our hips and essentially our core, okay? So the first one's pretty common. We all know the bridge. If you guys don't know how to do a bridge, you can learn right now, okay? So again, on your back, legs down, perpendicular, parallel. All you're doing is just lifting the legs up and down, up and down. All right, so that basically targets our glutes and our hams and some part, our glutes and our hams. If you wanna make it more challenging, okay, you do it essentially on one leg. So what I mean by that is, let's say you get one leg up, you're just bridging up and down, up and down. Simple, right? The next exercise we're gonna be doing is called a posterior pelvic tilt. And this is gonna ideally target the abdominal muscles of our belly, right? Simple as enough. So all you're gonna try and do is basically try and flatten out your back. It's hard to really see, but imagine you have your belly button and you're trying to push it straight down towards the ground. Literally doing, it's a very subtle movement. You can't really see me doing it, but that's a good way to engage your core. Now, depending on how strong or how weak your hips are, the next thing you're gonna be doing is, if, by the way, you have a TheraBand, you could pretty much pick it up at Big 5, Walmart, or your exercise section. I'm not too sure how much they cost. I get these for free at work. So Envision Home Health, great company, is you wanna tie this in between your knees, okay? And you're gonna basically, all you're gonna do is just, we call it the clamps, open, close, close. And make sure when you do this, you're not slamming your legs, okay? You wanna get a nice, slow release coming back in. So that's what we call the eccentric motion of an activity of muscle motion, okay? The eccentric and concentric. So yeah, again, all of these reps you wanna do about 10 to 15, and you wanna make sure you're kind of challenged. And let me go back. So going back to the bridge, we can make it even challenging again. I mean, with PT, there's always, we just come up with crazy stuff all the time. And so what you wanna do, you do a bridge and you can do open, close, close. That's gonna kind of cramp your hamstring. It's gonna really, really target that. So, all right. Another one we could do is the Suzanne Summers Thigh Master. You guys remember that? It's literally So you're lying on your side, elbows down, and you're lifting up and down, up and down. That's really gonna target your hip abductors, like, ooh. I would not recommend adding any weights, and if you do, 1 pound, 2 pound max, because already doing this, I feel it, like, oh, take that, Suzanne Summers, thank you for that. But that's targeting your hip abductors again, okay? Abductor means to abdicate, to open up, right? Anyways, let's work on our glutes next. So our glutes are actually very important for, as far as pretty much everything. Low back pain, sciatica. So let's do what's called our glute extensions. So what you're gonna wanna do is lay down on your belly, okay? On your belly. I would recommend you start with your knees bent. That makes it a little, the lever arm is shortened, makes it a little easier. And you're gonna wanna squeeze your butt together and lift up and down, up and down. So again, make sure you really engage those glutes, okay? Because if you just lift up and down, you're kind of just using your hamstring and not so much your glutes. So make sure, if you need to describe how to activate your glutes, like trying to pinch a penny between your butt. Sorry to give you that description, but that's, or that visualization, but that's how you gotta do it, okay? So squeeze that butt, okay? Up and down, up and down. Obviously, your neck is not gonna be up. You wanna be flat. All right, let's move on. We're pretty much almost done here, okay? The next one is we kind of want to engage our core. How do we engage the core? All right, there's a couple of ways we can do this. One is this is what's called the Russian twist, okay? Your knees are up, back is up, and you want to make a fist. All you're doing is rotating, 1, okay? Again, about 10 to 15, 10 each side, so a total of 20 counts. And again, if you have any back issues, back pain, consult with your doctor first because you are twisting. So if you have any like herniated disc and all that, this might cause some problems. So don't do it if it causes any pain, okay? Just a reminder, any of these exercises should not be causing any pain. All right, next is the plank. We all know the plank. First off, let's make sure we're doing a proper plank. And the one thing that we are actually trying to strengthen is not the rectus abdominis, but actually the transverse abdominis. Fancy word. So you get in a, I guess, push-up position or elbow knees position. And once you're ready, just boom. Plank yourself up. So make sure you do this properly. Don't like sag, okay? You want your back flat, straight, I mean. And don't let your shoulders dip, okay? Don't do that, okay? I don't know if you can see with my shirt, but my shoulders are basically pinched together. You want to be completely up, okay? Try and hold this for, if you want to start off 15, 20 seconds, ideally work up to a minute. Hey baby, my dog. All right, we got 2 more exercises to go as far as how to strengthen our hip abductors and our hip extensors. And this is gonna involve us standing up, all right? Okay, all right, the last one. You wanna make sure you've got something to hold on to just for proper form. So find a wall, find a handle, find something. And I want you to imagine a clock. You have your 12 o'clock here, 6 o'clock directly behind me, 9 o'clock towards you guys, and 3 o'clock away from the camera, all right? So when you do this, you wanna make sure you're going completely at your 9 o'clock position. Out and in, out and in. Ideally, you wanna make sure to get some resistance, you wanna have a TheraBand, anywhere from like a yellow. Yellow is like the easiest one, up to like purple and blue, depending on how strong your hip abductors are, okay? One good way to really do this and target both your hip abductors and your hip extensors is to go towards your 7 o'clock and your 5 o'clock respectively. 7 o'clock meaning your left leg, 5 o'clock meaning your right leg. So you're gonna go at a diagonal, okay? And you just wanna, you'll feel it within like the first 2 or 3 reps, like oof. And again, it's not a big motion. You're not trying to get that leg straight high, like no. You're not trying to back kick somebody. And that's one thing I forgot to mention is proper form. Like you're not arching your back. So if you're going out, you shouldn't be twisting, okay? Your body's completely parallel. You're just moving that leg out and in, okay? Out and in. Same thing with your extensors. You're going backwards at your 6 o'clock. And again, you're not arching your back. Don't look like a goofball and do that. That's gonna kill your back. So these are basically some of the exercises that we can use to strengthen our hip abductors, our hip extensors. And so the last thing, and this is basically a very minimal aspect of treating sciatica, is massage. I would also recommend using a foam roller. What's a foam roller? Let's go show you. All right, my friends, this little black, literally I guess foam that they sell at pretty much anywhere is a foam roller. All right, this is probably the best and only physical therapy device you will ever need to use. So first thing you want to use or do it on is your hamstring, okay? So proper way to do it. All right, let's say my left side's a problem. I have really painful hamstrings. Put it behind your leg, literally. And you're just gonna prop your legs up and literally just roll it. I don't have any what's called sausages, or I don't have any knots on my hamstrings, so I'm not really feeling much. But you could basically rotate your body around too. So I'm gonna show my right leg, but you could kind of go inside if you want to target like the inner hamstring. You could rotate the other way. Let's just do my left side again to kind of get like the lateral or the outer hamstring, I mean, if you want. Now, if you want to target your glutes, obviously you go to where your glutes are and you just kind of angle it to where you can really feel it. You're just rolling it again, and that's actually kind of tender, like, ugh. And it's gonna hurt. If you want to have less pain, you want to obviously increase or decrease the amount of gravity that's against your butt, right? So you got something to hold on to ideally, or just go on your weight, put some more weight on your elbows, yeah. Or put more weight on your right leg or whatever leg you're supporting yourself with. Ooh, that's sensitive. I've been sitting way too long. COVID-19 makes me just want to sit all day, right? Gyms closed, parks closed, can't play basketball, so sit on my ass all day making videos because I enjoy it. Oh God, that's sensitive. But anyways, you get the idea. All right, so that's essentially and effectively how you can treat sciatica in your own home. Now, obviously this is not a guaranteed program, and I really hate to say I promise you, but I'll say it. Assuming you have nothing serious going on with your back, again, no stenosis, no lumbar, herniated disc, things like that, I promise you that if you do these exercises, these stretches, these strengthening exercises, and the massage for about a week, I'll give it 2 weeks max, give or take, you will have less symptoms of numbness, tingling, and that weakness issue. Again, assuming that you don't have any other neurological symptoms going on in your spine. And obviously I want to mention that a part of why we experience a lot of these symptoms of sciatica, these numbness, this tingling, this dead leg feeling, is because we're pretty much sitting way too much as a result of compressing that nerve, right? If we're sitting on our tush for like 5 hours, 6 hours and not really moving around, that nerve is gonna get compressed. So of course we gotta move around. And what I always like to recommend to my senior population patients is that if you're gonna be sitting for at least an hour, set an alarm clock or reminder or whatever it is to just get up and walk for like 2 minutes, 3 minutes. Like make an effort to go to the bathroom, the kitchen, or just walk around and just really just swing those legs and just move, because let's face it, our bodies are meant to move. We're not meant to just be stationary watching TV, watching Netflix or whatever, playing video games all day, or sitting in front of an office chair just typing our life away. We're not meant to do that. And so I recommend to you is that if you are the type of person who sits and you just forget to like get up and do something, set an alarm clock, literally. For every hour, just get up for 2 to 3 minutes, or even half an hour for that matter, because even sitting an hour is too long. Set that alarm clock and just start walking, like really take those strides to just walk, you know? So I hope you found this video informational. And again, if you have these symptoms of sciatica, obviously consult your doctor first via telehealth if COVID-19 is still a thing. And just make sure you get the consent and the okay from your doctor. But otherwise, if you are going to be seeing a physical therapist for this, more than likely they're going to be giving you very similar activities and strengthening exercises, some stretches, and they're obviously going to massage you. And of course, it's going to feel good. And so I figured save some money and just do the treatment on your own, because I guarantee you these are the things that they're going to be working and doing on you as well. All right, again, I hope you enjoyed this video, and this was my first video of the series as far as like how to do physical therapy on your own. And if you guys have any, I guess, comments or recommendations down, just leave a comment down below and I'll definitely be glad to check it out. Other than that, be safe, continue to wear your face mask, wash your hands, wash your hands, soap, alcohol, whatever it is you got. And I hope you took care of this sciatica pain. So, all right, I'll see you next time.